do want to introduce Beth Kidder, our Deputy Secretary for Medicaid. Beth is going to come up and give some opening remarks before we begin.
Well, good morning, and thank you all for traveling to be here today. I want to also thank the Secretary for being with us today. We think this is a very important beginning of a dialogue. We are very passionate about serving the children, and we know you are too. And so we have that in common. We have a lot of common ground on that. And we are ensuring that we want to ensure that they get the best care to improve their behavior and their everyday functioning. We also know, and we feel the pain that you have been feeling over the past year as we have made a lot of rapid changes in this service. And the reason that we have done that is to ensure that the quality integrity of those services. We saw a lot of disturbing things about the quality of services that were being provided by some providers provider qualifications, and some providers abusing the system. Okay. And so that is why those changes have been made. However, that kind of rapid change is not our preference. We know that you need to adapt your businesses and your business practices in order to make these changes happen. And that's really why we're here today, is to start to hear from you about the changes that we have upcoming. Every action that we are taking is to ensure that the children are getting the right service at the right time from an appropriate and qualified provider. We have to ensure that children get all the medically necessary services that they need, and these changes are really to ensure that going forward, to make sure that that happens. Now, the changes that we are discussing, I know we are not always going to agree on the methodologies that we choose to ensure that, but we do need to hear from you about the impact. And that's what this meeting is about. That's what the meetings are that we've scheduled around the state. I will apologize that I understand you all had a conference going on, and we did not know that. We would not have scheduled this during a time when you had an association meeting going on, and I hope that we can avoid those kind of conflicts in the future by having a more open dialogue between the agency and the providers. As Siobhan introduced, and we introduced ourselves, we brought all of our issue experts here today, because we really do want to try to make sure that you're getting a good foundation, a beginning point of understanding what we're proposing, and we can answer as many questions as possible. And that is what we'll be doing over the next month as we travel around the state, and we have various means for you to submit comments and questions into us. And this is just the beginning. Each one of the things that we're introducing today will have much more detail, training, and outreach as we roll them out. But we do want to just start today with a dialogue and starting to get feedback from you. So again, thank you for coming, and we will begin to start talking about them now.
Okay, so you should have an agenda in the information that you received as well. We are going to touch on the topics in the order as is listed on your agenda, and I won't belabor that point any further. All right, so we are implementing several changes related to coverage and payment of behavior analysis services. Our goals with these changes are to ensure that the services that we are covering and paying for are medically necessary, that children are receiving comprehensive quality care, that there is comprehensive care planning in the delivery of services, that services are delivered as authorized, and that we deter any aberrant billing and practice patterns. Many of the changes that we are going to speak to you about today will be implemented around July 2019. If a start date or implementation date is later or potentially any earlier, I will note that throughout this morning's presentation. So the first change that we want to make you aware of relates to the moratorium, that the provider enrollment moratorium that has been in place in Miami-Dade and Broward counties since May of 2018. The agency will be seeking concurrence from the Centers for Medicare and Medicaid Services to partially lift the moratorium in those two counties for registered behavior technicians board-certified assistant behavior analysts, and lead analysts who are seeking enrollment in Florida Medicaid and are wishing to be linked to a provider group that already has a Medicaid ID number. So the moratorium will still be in effect for groups, new groups that are seeking enrollment in Florida Medicaid, and for lead analysts who are wishing to practice independent of a group. But we feel at this point, given the advances that we've made in terms of some of the safeguards that have already been put in place, that we can partially lift the moratorium, which will serve as an opportunity for those groups in Broward and Miami-Dade to backfill any vacancies. We certainly have heard from some of the groups around the hardship that that has caused. And so we believe this is a step in the right direction in helping those agencies be able to backfill those vacancies. As I said, we need to receive concurrence from CMS in this area, and so it is not effective yet. We also need to update our system to be able to accept the provider enrollment applications that will come in. So in order to lift the moratorium, we actually need to make some modifications in our system. We are anticipating that we should be ready sometime towards the end of April. We will notify the providers in those areas via a provider alert. So we're asking that you not start to submit applications now, but rather wait for indication from the agency that we are ready to begin processing those applications. We have heard a lot of feedback from the provider groups around our provider enrollment process and opportunities to be more transparent in those processes, and we certainly hear you. And so we recognize that there will be an influx of applications that will begin to come in as a result of doing this partial lift. And so we are planning on hosting some provider enrollment training sessions in late April into May to provide better guidance and clarification on what is required in submitting a clean Medicaid enrollment application so that it can be processed as timely and effectively as possible. The next change that we want to share with you is that we will be requiring the provider groups to provide information to the agency demonstrating that you have obtained a healthcare clinic license as required in Florida statute, or that you have a certificate of exemption. So this is not a new requirement in Florida law. Any entity that is rendering healthcare services and seeking reimbursement from a third-party payer like Medicaid or Medicare is required to have a healthcare clinic license. We are just simply making sure that all of the group agencies and providers actually have obtained one. So we will begin that verification process later in the year. On the slide, you see a link to the agency's website. That link will take you to where you can learn more about the healthcare clinic license if you are not currently licensed and need to obtain the license to meet the requirement. It has the information about the application, the cost of the application, and so again, hopefully all of you are already licensed, and this is a no-brainer. You're just going to be submitting that verification to the agency. But if you are not, we are giving you information on where you can go to our website to obtain any information in that regard. Again, this is not a new requirement. The healthcare clinic licensure law passed in 2003. And so it is the provider's responsibility to self-report to the agency, to our Division of Health Quality Assurance, if they believe that they meet the healthcare clinic licensure requirements. And so we do rely on the providers to do so. We're just validating and verifying that you are in compliance. So we have received a lot of feedback about our current service authorization process. And so we are planning on implementing some improvements or enhancements in that process. We intend on deploying a multidisciplinary team approach in the authorization of behavior analysis services. The multidisciplinary team approach, we believe, will be the most beneficial in determining the appropriate services and